Sure. In the 1990s, recognizing that there was a problem with NCDs in the entire region of the Americas, PAHO decided to create a network of people interested in doing something about NCDs and their risk factors. So they decided to create a network of persons to collaborate together on risk factor reduction and management of NCDs. And that's the basis of the name CARMEN, which is an acronym for Collaborative Action for the Reduction of Risk Factors and Management of NCDs in English and in Spanish. And CARMEN Network was first established in 1997, and it was established to first develop the epidemiological basis to understand what is the problem, what is the magnitude of the burden of NCDs and the risk factors in the region. So a lot of studies were started in a few demonstration projects to first collect information and then develop demonstration projects to help reduce risk factors, help increase public awareness of the problem. And so from the initial beginning of 1997 of a few countries starting demonstration projects and collecting basic information on NCDs and risk factors, it's evolved in its 15-year history to now including all the countries in the region of the Americas working together on policies and programs and activities at community level, subnational level, and national level on NCDs. I would say the biggest change has been an increase in the political will and recognition that NCDs are a big problem, not only for health, but also for development of the country. So NCDs have a burden on individual health and their development, but also on the system, the health system itself, to manage the caseload of patients and having to manage their symptoms and their problems, and then also on the economy, because when a person is sick, he or she is not working. And so all of that at a national level is having an impact on the economy, on the health system, and on the individuals and communities. So there's greater recognition of the problem, there's greater political will within the ministries of health to address this and to do something about it. And I would say that's the biggest change. My greatest expectation is that we're going to move from the political declarations which were made last year at the UN high-level meeting on NCDs, where heads of state and heads of government committed themselves to a number of actions for NCDs and risk factors, that we're going to move from those political declarations and translate that into community-level actions. So increasing awareness of an individual, better management of people with NCDs, better screening for people so that you detect the diseases earlier and have a better outcome for the patients. And that really we transform from the declarations to the actions.